When New Zealand went into lockdown as a result of the COVID-19 pandemic, engineer Jeff Sharp and emergency specialist Dr. Martin Harvey got to work to design and manufacture the VC pandemic ventilator.
We thought, like a lot of countries around the world, that this is going to be serious. At that point we were anticipating that the border would be closed and that our supply lines for New Zealand, being an isolated island, were going to be locked up.
Dr. Martin Harvey is the leading clinician in the COVID-19 response unit at Waikato Hospital, one of New Zealand's largest hospitals.
When we look back to March now, New Zealand's done exceptionally well, and we haven't had the peaks of COVID cases that other parts of the world have. But back in March we were anticipating anywhere from 1,500 to 7,000 patients requiring mechanical ventilation, and our national ICU capacity and bed state was that we could probably accommodate maybe up to 500 patients in intensive care beds. So we were well short of what projections were looking like.
Part of the New Zealand government's response to the pandemic was a COVID Innovation Fund. This supported RespiratorNZ to turn the VC pandemic ventilator into a reality. To qualify for the Innovation Fund, there were some rigorous international standards to be met.
It's a volume-controlled ventilator, so there's standards that were put out by the UK around flow rates and times and pressures, what material the thing is made from, how durable it is, how long the battery life lasts. We have a full validation document to prove all of the parts of the standard are met.
Keeping our health workers safe is a crucial part of a pandemic response, so the ES Plastics engineering team devised remote wireless capabilities as a standard feature. In less than 20 minutes, non-ICU health technicians can be trained to use the VC pandemic ventilator. High-level adjustments and monitoring can be done remotely, reducing the risk of contamination between the patient and healthcare professionals. This makes the VC pandemic ventilator the ventilator you want.
And so that's where we've ended up with the wireless capability that our ventilator has, with the idea that the person adjusting ventilator settings doesn't have to be immediately bedside and therefore at risk of any sort of communicable disease while they're making those adjustments.
A fresh perspective from outside of the medical profession has allowed ES Plastics to repurpose existing and proven technologies into a new design opportunity.
We had the ability to manufacture large quantities of these ventilators, so keeping the design simple is important for that. This means that all communities around the world will have access to a ventilator at a reasonable price.
A key feature of the ventilator by the team is the single limb design, which offers a higher level of safety for both patient and healthcare professionals.
Our patient circuits are a simple single limb circuit, direct from the machine to a patient valve. Very little risk of contamination to the machine, but we can use any filter that fits in a standard patient circuit. We can use any patient valve that fits in a standard patient circuit. We're not limited to just proprietary consumables.
ES Plastics has an established history of developing and supplying international organisations, including pharmaceutical brand Pfizer. Using specialised equipment to gather comprehensive data sets is everyday practice for ES Plastics.
Using a calibrated machine called a Citrix H4 to test our ventilator with different flow rates, different amounts of oxygen or air, so different mixtures of air and oxygen, and different rates of breaths per minute, and we've been able to confirm that our flow rates, as we dial them up on our ventilator, that they meet the standard, and we've got pages and pages of data to prove that.
In New Zealand, we are very aware of the consequences that a pandemic situation can bring, and we'd like to contribute our Kiwi ingenuity to the world.
We're very lucky in New Zealand that these may never be rolled out in this part of the world, and that's a fortunate twist of fate for us. But there are other countries and jurisdictions around the world where not as lucky as we are, not as fortunate, and their lives are no less kind of valuable than ours.
ES Plastics can scale production to manufacture over 100 VC pandemic ventilators every day.
And going forward, even when COVID dies down, there'll be the requirement for major hospitals and lesser kind of centres to stock ventilators that can be rolled out for pandemic use or for disaster use.
The VC Pandemic Ventilator is designed to be easily used by non-ICU trained medical staff. It is compatible with non-proprietary consumables, including a generic patient PEEP valve and generic off-the-shelf tubing. It has the capabilities to run off an external battery backup for up to 6 hours using swappable and non-proprietary batteries. It is designed for use in emergency centres.
I hope these will be rolled out and used to deserving people everywhere. And we're away.
We developed the VC Pandemic Ventilator because every life deserves to be saved.